How do you know if you might have type 2 diabetes? Because initial symptoms are subtle, people who have diabetes often find out accidentally from routine blood tests. Unfortunately, by this time, serious complications like damage to their organs may have already developed. One major combination of symptoms is frequent urination and increased thirst. High glucose in the blood causes fluid to be pulled out of your tissues and pulled into the bloodstream. The excess fluid is excreted as urine. This also causes dehydration, which makes you thirsty. As a result, you may drink and urinate more than usual. Another major combination is increased fatigue and hunger. As we learned earlier, if you have diabetes, your cells do not take in enough glucose to make the energy they need. Thus, people with diabetes feel tired and hungry. Other possible symptoms of diabetes are unexplained weight loss and nausea. A definitive diagnosis of diabetes can be made by simple blood tests, such as the fasting blood glucose test and the glycosylated hemoglobin test. Fasting blood glucose measures the levels of glucose in the blood after the person has fasted for 8 to 12 hours. The test is usually done in the morning before breakfast, either in a clinical laboratory or at home. Here are what the numbers from the test mean. Basically, levels of glucose above 126 milligrams per deciliter indicates that the person has diabetes. To measure glucose levels at home, glucose meters can be bought in most drugstores. They are simple to use and need only a drop of blood from pricking. Just follow directions on the package. The glycosylated hemoglobin test measures glucose that is accumulated for the past 3 months. It is conducted in a clinical laboratory. Here are what the numbers from the HbA1c test means. Basically, an HbA1c level above 6.5% indicates diabetes. If left untreated or uncontrolled, diabetes can lead to serious health consequences and even death. Since the high blood sugar level affects all blood vessels, and since the vessels reach all the cells of your body, a large variety of organs can suffer damages. Your eyes. Diabetes is the leading cause of blindness in adults in the United States. The high blood glucose levels damages the many delicate blood vessels in your retina, which is the part of the eye that lets you see. Retinopathy, a disease of the retina, can be detected by a comprehensive eye examination. Your nerves. Diabetes is responsible for more than 60% of lower limb amputations that are not caused by accidental injuries. This is because diabetes causes nerve damage and diminishes blood flow. If blood sugar levels remain high and uncontrolled, diabetes can lead to sensation problems, ranging from tingling and numbness to a total loss of feeling in the limbs. Lack of blood flow to the nerves can also cause pain, problems with senses, and problems with digestive, bladder, bowel, or sexual function. Nerve damage can be detected with physical examination. Your kidneys. Diabetes is the leading cause of kidney failure in the United States. Just like your eyes, your kidneys are made up of an intricate network of blood vessels. In the kidneys, these blood vessels filter out toxins and waste from the bloodstream. High blood glucose levels damage these delicate blood vessels and can lead to kidney failure. Kidney failure is a major health problem that requires many long-term treatments, like painful dialysis procedures and waiting for a kidney transplant. Kidney damage can be detected with a simple urine test and a blood test. Poor kidney function can also be associated with high blood pressure. Cardiovascular disease. About 65% of people with diabetes die from heart disease or stroke. High blood sugar causes the blood to be thicker in consistency than usual. This can lead to angina, or chest pain. A lack of blood flow to the heart can cause a heart attack, and a lack of blood flow to the brain can cause a stroke. An electrocardiogram, or ECG, and a stress test can be usually used for detection of heart problems.